Hello, I am AARP Vice President Bill Walsh, and I'd like to welcome you to another AARP Conversation with national experts and leaders who will answer your questions about protecting your health and well-being, as well as that of your loved ones. Before we begin, if you'd like to hear this telephone town hall in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione *y 0 en su teléfono ahora.
AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. As November brings in cooler air and festive autumn colors, it also brings a flurry of health concerns, including the flu, the RSV respiratory virus, and new strains of COVID. We have also seen a persistent flurry of misinformation about COVID vaccine safety and effectiveness. Navigating the fall season these days requires informed health decisions, especially for older Americans. Today, we're joined by an especially informed expert on these topics and more. Dr. Mandy Cohen is the new director of the Centers for Disease Control and Prevention. Her insights and guidance will be helpful as we discuss health challenges during the holiday season, and she'll be answering your questions live. If you've participated in one of our Tele-Town halls in the past, you know this is similar to a radio talk show, and you have the opportunity to ask your questions live. For those of you joining us on the phone, if you'd like to ask a question, just go ahead and press *3 at any time on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue to ask that question live. If you're joining on Facebook or YouTube, you can post your question in the comments section. Hello, if you're just joining, I'm Bill Walsh with AARP, and I want to welcome you to this important discussion about vaccinations, the impact of health misinformation, and insights into long COVID. We'll be speaking today with Dr. Mandy Cohen, the director of the Centers for Disease Control and Prevention, and taking your questions. This event is being recorded, and you can access the recording at aarp.org/health discussion 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staff member, or if you're joining on Facebook or YouTube, just drop your question into the comments section. Now I'd like to welcome our special guest. Dr. Mandy Cohen is the director for the Centers for Disease Control and Prevention, the CDC. Recognized as one of the nation's premier health leaders, Dr. Cohen has an extensive history of leading public health organizations and a respected record of safeguarding the health and safety of Americans. Welcome, Dr. Cohen, and thanks so much for being here.
Bill, thanks for having me. Looking forward to the conversation.
And just before we begin, I wanted to express our appreciation for your time today, particularly since this is a special day for you and your family. We understand that later today you'll be recognized with North Carolina's highest civilian honor, the North Carolina Award, for your role as the state Health and Human Services Secretary from 2017 to 2021. And your role in the state's coronavirus response. That was quite a time to be in that role. Congratulations on that honor.
Thank you. An honor of a lifetime to serve and lead the state for 2 years during the COVID crisis. A lot of lessons learned, and I'm excited to talk today about making sure we're continuing to protect each other.
Very good. And just a reminder to our listeners, if you'd like to ask a question to Dr. Cohen, press *3 on your telephone keypad or drop it into the comments on Facebook or YouTube. All right, well, let's get right to it. Dr. Cohen, the flu virus has been with us for generations. Why is an annual flu vaccine important, and what's the risk of skipping it?
Great first question, Bill. Right, we know flu. It comes every year. But what we know also about the flu virus, it changes. It continues to change as a virus, which is why every year we need an updated annual flu shot. And it's really important to get that flu vaccine every year, particularly if you're an older American, because the flu virus can really cause you serious illness. We know it causes serious illness in older adults and young kids. And no one wants to miss out on important events like Thanksgiving that's coming up. It could make your chronic medical problems like asthma or other things worse. So it's really important for you to get that updated flu shot each and every year. And the risk of skipping it is honestly a risk to your own health and possibly hospitalization or even death. We don't want to see that happen. Flu shot's really important.
Now, Dr. Cohen, there are 3 flu vaccines available for older adults. How do they differ, and how do you select the right option?
There are 3 different flu vaccines. What I would say for folks to take away from this is talk to your doctor or talk to a pharmacist about the flu vaccine that is recommended specifically for adults 65 and older. There are really 3 kinds. One is called a high-dose vaccine, one is an adjuvanted vaccine, and a recombinant vaccine. So really the takeaway is talk to your doctor or your pharmacist about which is the right one for you. They all have slightly different ways in which they can protect you. The most important is that you get a flu shot. Then talk to your doctor or pharmacist about which one of those, either at high dose or recombinant or adjuvant, is right for you.
Okay. Now, if you received your flu vaccine today, is it too late to benefit with Thanksgiving just 2 weeks away?
No, it's not too late. So we're 2 weeks away from Thanksgiving, and that is exactly the amount of time we want to see to build up antibodies ahead of something like Thanksgiving. So the good news is flu activity is pretty low right now across most of the country. So right now is still a great time to get yourself vaccinated ahead of that virus starting to spread more in your community. And these next 2 weeks gives you the opportunity for your body to build up antibodies. So when you get a vaccine, your body starts to build up antibodies. It takes about 2 weeks to be fully protected from that vaccine. But I would also say it's not too late. Even if you couldn't do it this weekend ahead of that 2-week period before Thanksgiving, vaccines will protect you then for Christmas, right? And for the next. So we want to just make sure you're making time to get that flu vaccine. And remember, we're going to talk about the updated COVID vaccine as well. So there's 2 important vaccines you want to be getting this season.
Right. Well, let's get into that. Now, in addition to the flu vaccines, older adults have a lot of choices when it comes to vaccine. Mm-hmm. There's a new RSV vaccine that was recently approved, and new and updated COVID vaccines, which you just mentioned. They're here ahead of the winter virus season. And of course, for many older adults, a shingles vaccine is really, really important. Can you help us sort it all out? What's needed when? Can some of the vaccines be taken together?
Yeah. So I know there's a lot. It seems like, wow, there are a lot of vaccines, and that is a good thing, right? That is good news that we've had this scientific innovation to bring us more and more tools to protect you and your health, right? So there are several things that are recommended for older adults. We've already talked about the flu shot. That's one you want to get annually. We mentioned the updated COVID vaccine as well. That is recommended for everyone also over the age of 6 months. And again, similar to why we get an annual flu shot, COVID also is changing, and we need to make sure we're getting the updated COVID vaccine to match the changes in the COVID virus. And then for the first time, Bill, you were right, in history, we have a new vaccine against RSV. That is another respiratory virus similar to flu and similar to COVID that circulates in the winter and also impacts people who are older adults. So we have a vaccine for adults over 60 so a flu shot, a COVID shot, and then this updated RSV. And of course, shingles, pneumonia vaccine, Tdap, tetanus. There are a lot of vaccines out there. The ones you want to be focused on for the winter season are those flu, COVID, RSV vaccines. But of course, don't forget about the pneumonia vaccine, shingles, and others. Again, so many ways to protect yourself.
Okay.
And I want to just remind folks, talk to your doctor about how to sequence these vaccines, right? There's a lot of them. They can best help you to know which ones to get when, but it is okay to get multiple vaccines on the same day. That is definitely okay, but I would talk to your doctor or your pharmacist or your nurse practitioner, and they can help you sort through what is the best way to get those vaccines and sequence it so that you're the most protected.
Okay, very good. And there's been some news recently, hasn't there been, about studies looking at the safety of taking 2 or more vaccines at the same time. What do we need to know about how CDC and the FDA are monitoring vaccine safety? What's the threshold to alert the public to a possible safety issue?
Yes. So safety is such an important issue, and it is top of mind to me and the team at the CDC and the FDA. I want folks to know that these vaccines not only have been through extensive safety monitoring before we allowed them to be available for everyone, but we continue to monitor the safety of them to make sure we are finding anything that might be an issue. We're constantly looking at data from multiple systems and sources for any signs of an issue. And you may have even seen us at CDC report potential safety signals, even when we think it's highly unlikely that an issue is caused by a vaccine, but we want folks to have the information so that they can make informed decisions. We share those potential, even safety signals, to be fully transparent so that everyone knows we are looking out for their best interests. We don't want something that would harm folks. So we continue to study these things, and we are making sure that they're meeting the rigorous high safety standard so that folks can feel confident when they go to get their vaccine.
Now, if folks do have concerns about the safety of any of these vaccines we've been talking about, is there a place they can go and learn about what the safety protocols are, or if you all have found any issues to call to the public's attention?
Sure. Well, certainly they can always go to the CDC website, where we continue to have information about these vaccines, about the safety, about the trials. And I would always encourage you, again, and you'll hear me say this probably a few times this hour, talk with your doctor. Talk through with your doctor about information. Make sure that the information you are getting about your vaccines is from reputable sources. Talk that through with your doctor and make sure that they're able to answer your questions and make sure you're getting that information from a good source.
Okay, very good. Well, what do you say we take some questions from our listeners? Just a reminder to our listeners, if you'd like to ask a question to CDC Director Dr. Mandy Cohen, press *3 at any time on your telephone keypad, or if you're on Facebook or YouTube, just place it into the comments section. And if you'd like to listen to this program in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione *0 en su teléfono ahora.
Okay, now I'd like to bring in my AARP colleague, Kevin Craiglow, to help facilitate your calls today. Welcome, Kevin.
Thanks, Bill. Happy to be here for this important conversation today.
All right. Who do we have first on the line?
Our very first caller is Marianne from Connecticut.
Hey, Marianne. Welcome to our program. Go ahead with your call for Dr. Cohen.
Thank you very much. My question was on the RSV. How important is it for an 85-year-old to get that shot, and how often should they get it?
Dr. Cohen?
As well as a shingles shot. How often should you get the shingles shot repeated? Okay.
Dr. Cohen, can you take that?
Sure. Well, Marianne, thanks for that question. So it sounds like you're 85 years old. We are recommending the RSV vaccine for everyone over the age of 60. And certainly as your age continues to go up, I would say that there's increased risk of you having more serious illness from RSV. So I would definitely say that you are someone who should talk to your doctor and think about getting the RSV vaccine. And depending on your medical status, again, talk to your doctor about how and what the dose is of the vaccine and if you might need it to be repeated. Some of the vaccines do need multiple doses depending on your underlying medical condition. Some of us have immune systems that are more suppressed, and so maybe you're fighting off cancer and you're on cancer treatment, or you have an autoimmune disease. You may need additional doses of that vaccine, but most folks need one dose of that RSV vaccine, and then they are set for this season. On the shingles, that is also a single dose vaccine. That is one, again, that is something that could happen any time around the calendar. So while RSV generally happens in the winter, shingles, which is something that can be quite painful, can come up at any time through the calendar year. So that is something you could protect yourself at any time, but really, really important to do as well.
Okay, thanks so much. Dr. Cohen, I thought the shingles vaccine was a 2-shot regimen. Has that changed?
It is. It is a 2-shot regimen. You are correct.
Okay, very good. All right, Kevin, who is our next caller?
Bill Carroll from Massachusetts is our next caller.
Hey, Carol, welcome to our program. Go ahead with your question for Dr. Cohen.
Yes, we are a couple that are over 65. We're going to be traveling in December. We received our flu shot in September. We received our RSV shot at the end of October. We received our... What's the next one?
COVID.
COVID. Thank you. Yeah. COVID was this past week.
Good.
So
great.
My question is, we are going to Las Vegas, where obviously there are large crowds, large venues. If we go into theaters, we're traveling on a plane. Should we be wearing masks as well while we're traveling to Vegas? Home from Vegas, 6-hour flights, roughly 5-6-hour flights.
Good. Wonderful question. But first, let me say, very well done. You've gotten all 3 of those vaccines, so you're protected going into the season. But we know that is one layer of protection. The good news is we have multiple ways in which we can continue to protect ourselves from these viruses. Certainly, vaccine is a strong and thing you can do ahead of the season. It builds up antibodies. But particularly depending on your age and your underlying health conditions, you may want to layer on additional things that help protect you from getting sick. And remember, these vaccines are meant to stop the worst of what this virus could bring, meaning hospitalization or death. It doesn't necessarily protect you from getting it in the first place, but there are additional things we can do to even prevent us to try not to get the virus. You mentioned masks. That is absolutely a tool that works. Masks do work to protect you from being able to, to protect you from circulating viruses that are in the air. I would also say make sure, and it's hard, particularly when we have a planned trip, stay home if you're sick. And it's important, if you do feel sick, get tested. And the reason you want to get tested is because we have treatments for flu, for COVID, and you want to get those treatments right away because like vaccines that can save your life, treatment also can save your life. So on your trip to Las Vegas, I would take some rapid tests with you. You can order them for free from covidtest.gov. You can order them right now. Because if you do come down being sick, I'd want you to get tested right away so you would know should you go to urgent care and get treated, because that could save your life as well. So all of these things, testing, treatment, masks, and I'd say improved ventilation. So while you're in Las Vegas, the weather is nicer there. Get outside, right? Those are ways in which you can reduce doing activities outside, reducing your risk of virus spread. So, in particular, the older you are or the more underlying medical conditions, you're at higher risk. So the higher risk you're at, the more of these layers you want to add on. Vaccines, testing, treatment, masks, ventilation, right? So all of these, don't forget washing your hands, right? All of these matter to protecting yourself, and you want to layer as many as you can because, one, you don't want to be sick on your vacation, and then you also don't want it to give it to others. So if we use all of these tools, you're doing great.
Very good. And Dr. Cohen, you mentioned something really important there about the free tests still being available. Those COVID tests can be a little pricey. It's nice to hear that they're still available. Do you happen to know where people should go to place their orders? Yes,
you can go to covidtest.gov. That's covidtest.gov. And you put in your address, and they will send you for free tests. Yep.
Okay, very good. Kevin, let's go back to the lines. Who do we have up next?
Bill, our next question comes from Simone, who's joining us today via Facebook. Simone asks, how safe is it to take the flu vaccine and the pneumonia vaccine at the same time?
Dr. Cohen?
Well, thanks for that question. We do not have a study that looks specifically at the pneumonia vaccine. I think that was the question, pneumonia and flu at the same time?
Correct.
I just want to make sure I heard it correct.
Yes.
Yes. So we do not have a specific study on looking at pneumonia and the flu vaccine at the same time. Generally, what we have been sharing is that it is a best practice to get multiple vaccines at the same time. But this is where you want to talk to your doctor and talk through. What we have studied more is COVID and flu at the same time, but we haven't looked at the pneumonia and flu at the same time. So I think that is one you will want to talk to your doctor about. Generally, we have seen that getting multiple vaccines on the same day is completely fine. But again, this is important for you to talk to your doctor about.
Okay, very good. And just a moment ago, Dr. Cohen mentioned how to get those free COVID tests. I just wanted to repeat that for folks. You can go to a website, covidtest.gov, or you can also call a toll-free telephone number. That's 1-800-232-0233. 800-232-0233. All right, Kevin, who do we have up next?
Our next caller is Vanessa from Texas.
Hey, Vanessa, welcome to our program today. What's your question for Dr. Cohen?
Thank you. My question is, when will the nursing home facilities begin COVID test? I have a brother that is in one of them, and they haven't had them yet.
Well, thank you for that question. Now is the important time for folks to get these vaccines, and I think I heard you say that your brother is in a nursing home and they haven't been offered the vaccine yet. What I would do as a family member would be to call to say, we want to make sure that he's protected and understand their plan for getting vaccinated. What I can say is there is plenty of supply of vaccine, that these vaccines are covered by insurance. So those who are over 65 and on Medicare can get these vaccines covered for free. And if they happen to be uninsured, the CDC does run a program for free vaccines for folks as well. I will say we've also worked with nursing homes to make sure that we are addressing concerns or barriers that they may have. I've actually been visiting a lot of nursing homes around the country to understand how they're encouraging vaccines, and some are doing a great job making vaccination fun as much as that can be possible. They make it into a little competition, and that has been really great. But we know that is not every nursing home. So I would encourage you as a family member to call on behalf of your brother and inquire about when they can vaccinate, because those vaccines are available and they are really important for folks.
Okay, very good. Thanks for that. We are going to thank you for all those questions. We're going to take more questions soon, so hang with us. And remember, if you'd like to ask a question, please press *3 on your telephone keypad. But let's shift our focus just for a moment to Capitol Hill. I want to discuss for a few moments how AARP is fighting for you on critical issues. Today we're going to speak with Kristen Dillon, a Senior Vice President here at AARP. Welcome, Kristen.
Thank you, Bill. I'm happy to be here.
All right. We're also going to be joined by Jill Tyler, a recently retired professor of health communication and AARP New Hampshire volunteer. Jill was also the state president for AARP in South Dakota for 6 years. Welcome, Jill.
Thank you, Bill. I'm glad to be here.
All right. We're glad to have both of you. Now, we're fortunate also to have the director of the CDC with us talking about important health issues. Kristen, what are some of the health-related changes AARP is fighting for on behalf of older Americans?
Well, Bill, I am happy to share that AARP is fighting, first, to strengthen Medicare, to lower prescription drug prices, to support family caregivers, and to save people money. So right now, we're urging Congress to cover more home care and telehealth services, so that more people can keep getting the care from the convenience of their home. We're also advocating for better mental health coverage and for Medicare to cover dental, hearing, and vision so that every person can get the full range of care that they need.
Okay, thanks very much, Kristen. Jill, turning to you, the biggest recent win has been allowing Medicare the right to negotiate the price of prescription drugs with the big drug companies to bring down prices. Why is prescription drug reform so important?
Well, this reform is so important because the costs are astronomical. As Americans, we pay more for these same drugs than those in any other country. And that is why AARP has fought for decades to lower prescription drug prices. And now, for the first time in history, the prices of some medications will be subject to direct negotiation with Medicare. As a lifelong health educator and longtime volunteer, I have seen that the main reason older adults skip or end up rationing their prescription medications is because they can't afford them. Wouldn't you agree about that, Kristen?
Yeah, absolutely, Jill. Those are the stories that we hear and that are so heart-wrenching. The good news is that AARP is winning this fight, and the tide is turning, and our members are demanding lower prescription drug prices. Medicare recently announced the first set of 10 medications they will be allowed to negotiate costs for, and these include several well-known drugs that help prevent strokes, blood clots, and treat diabetes and cancer. Allowing Medicare to negotiate prices for these prescription drugs, with more to follow in the coming years, is a really common sense solution that will save seniors money and cut government spending. The big drug companies are trying to stop all of this, but we're continuing to fight to protect these cost savings and to allow for even more in the future.
Okay. Now, Jill, what are some of the other new prescription drug reforms helping Medicare beneficiaries?
Yeah, I'm glad to talk about this, Bill. Already in effect this year, the new law caps the cost of Medicare-covered insulin at $35 a month, and it eliminates out-of-pocket costs for most recommended vaccines we've been talking about today, including the new COVID booster and the shingles vaccine. There will also be a new annual out-of-pocket cap of $2,000 as part of Medicare drug plans starting in 2025. AARP has also succeeded in simplifying the Medicare enrollment process and in holding providers accountable for the quality of care they deliver. All of this will keep people healthier and will also put a little money back in people's pockets.
All right. Well, very good news. Finally, Kristen, is there more progress you're seeing on the health front?
There sure is. AARP has been very busy on a host of issues. Recently, AARP successfully advocated for access to more affordable hearing aids. And as a result, lower-cost hearing aids are now available for the hearing loss, something I know many people will benefit from. Caregiving is another big priority for our members, and we're pleased with the administration's recent executive order and follow up regularly with action to provide support for our family caregivers who act as the backbone of care in our country.
They sure do. And thank you very much for that, Kristen. Jill, I want to also thank you for dedicating your time to represent AARP members as a volunteer and for your many years of service doing that. If listeners want to stay on top of advocacy news from AARP, how can they find the latest updates?
So we encourage everyone to go online to aarp.org/get involved and sign up for the AARP Advocate. That's a free monthly e-newsletter. And once you sign up, you'll also receive email alerts about the latest advocacy news. That's aarp.org/get involved. It's an easy way to really make a big difference and to keep up with all the good news about how AARP is fighting for us.
All right, excellent. Thanks to both of you for joining us today. As a reminder to our listeners, if you'd like to pose a question to Dr. Mandy Cohen, go ahead and press *3 on your telephone keypad or drop it into the comments section in Facebook or YouTube. We are going to get to those questions shortly, but let's turn back for a moment to our conversation with CDC Director Dr. Mandy Cohen. Doctor, many Americans are still hampered by symptoms labeled as long COVID, such as dizziness, fatigue, heart palpitations, or difficulty breathing. How can people know whether they're suffering from long COVID? And what more do we know about treating these conditions?
Thanks, Bill. I wanted to just, before I get to long COVID, if I could, go back to the question about the pneumovax and flu. I just looked up to make sure, and actually the CDC did do some research on this and do recommend that it is okay to get your pneumovax and your flu shot on the same day. So thank you for that question. I just wanted to clarify. Okay, on to long COVID. So most people with COVID-19 get better within a few days, but as you were saying, there are some folks where we're calling it long COVID, can have a wide range of symptoms that last weeks, months, or even years. Sometimes the symptoms can go away and come back again. And so, we're really learning about long COVID. We see most of long COVID occurs when people have had a severe illness, but really you can even have a mild illness and see these extended symptoms. What we're seeing from early studies, and what I would emphasize is we're in the beginnings of really understanding it, that you are going to decrease your risk of having long COVID if you get the updated vaccine and if you have treatment. Again, it just reminds us to use some of these tools can not just prevent you from getting COVID in the first place, but if you do get it, it would reduce your risk of those extended long symptoms. Same reason about why you want to get tested if you are sick. Getting tested lets you know, is this COVID, and then allows you to get treatment. And that treatment can also cut down your risk of having long COVID. So we're learning more, and the Biden administration's invested a sizable amount of dollars into additional research so we can learn more about it. But the best way to protect yourself and others from getting infected is by staying up to date on those vaccines and then making sure you're getting tested and treating.
And what about treatments for long COVID? Is it generally like Paxlovid, which was a treatment for COVID, or are doctors suggesting that, the individual symptoms like dizziness, fatigue, et cetera, be treated on their own?
So we want folks to get treatment when they first know that they have COVID. So that's why it's important when you first feel sick get tested, and then get treated with something like Paxlovid. But if you're having those long COVID symptoms, meaning extensive symptoms, that is where we're still learning to understand how can we really tackle that. And you are right, the treatment in those cases is really more targeted to the symptoms, to try to clear up the symptoms. But we are starting to do additional research to understand, are there other ways that we can treat long COVID, but we're still at the beginning of understanding that.
Okay, very good. Well, let's shift a little bit. I want to talk about something that's been almost as persistent as COVID itself, which is misinformation. How has misinformation about COVID or other health issues muddied the education efforts by public health officials like yourself? And why do some people still distrust vaccines?
Well, look, there's a lot of new information on vaccines, and we've learned so much and shared a lot over the past 3 years. Right, it's the first time that we have had vaccines for all three of the respiratory viruses we're going to see this season, COVID, flu, and RSV. So we know that there is a lot of new information out there, and folks are sorting through that. We also know that there are bad actors working out there to spread misinformation. In this area, I really, again, encourage everyone to find trusted sources. Could be your doctor, it could be a community health worker, it could be someone at AARP, a trusted national organization. We want to make sure you're using these resources that are well vetted. And it is okay to have questions. That's exactly why we are having this call today. We want to answer questions, but we need to sort through good answers to questions versus the misinformation that is out there. Again, so talk to a doctor, a community health worker, a pharmacist, get information from credible organizations. I hope you come to the CDC and get information from us. But there are a lot of places where you can get good information. Just be good consumers of the information that is out there.
Okay, well, what do you most want people to know about vaccines?
Well, I want folks to know that vaccines are one of the best ways to protect yourself and your loved ones from serious illness, hospitalization, and death. I know many people have probably incorporated a flu shot into their yearly routine. What I want folks to know is that COVID is still causing more illness, more hospitalizations, and more death, particularly in those who are over 65, than flu. Flu's bad. That's why we encourage everyone to get a flu shot every year, and we see people in the hospital. But COVID is actually causing more disease and more hospitalization. So if flu shots every year has been part of your practice, make sure you're also adding that COVID vaccine to your routine. Again, what I want folks to know, it is okay to have questions. Talk to your doctor, your nurse practitioner, or others in the healthcare space to get your questions answered about vaccines.
Okay, since we're talking about some misinformation, I mean, we know that it spreads so quickly and prolifically online and through social channels. Maybe let's try to clear some things up for our listeners. I wonder, Dr. Cohen, if you could set the record straight about recent COVID misinformation that was attributed to CDC data. So, for example, are vaccinated people more or less likely to be hospitalized than those who are unvaccinated?
Well, Bill, this is a place where we have a lot of really good data, and we know that people who are unvaccinated, so they have not gotten vaccination, are more likely to be hospitalized. If you're not protected with a vaccine, you are more likely to be hospitalized. And again, we have multiple studies on this where we have seen that 75% of hospitalized patients over 65 had not received the latest updated COVID vaccine that was recommended at that time. So it's not a small difference. It's a large difference that these vaccines make. Another study showed that hospitalizations among unvaccinated adults were 3.5 times as high as those among vaccinated adults. And again, that was from an earlier period of time, but it just shows you that vaccines are really helping folks stay out of the hospital.
Okay, well, let me hit you with another one here. How well are vaccines working for children and teens? Since younger adults are at lower risk for severe illness, what are the benefits of them getting vaccinated?
Yeah, so, I am a mom of 2 daughters who are 9 and 11. And I got my daughters both the updated flu shot and the updated COVID shot. And here's why. We know that while kids are relatively less impacted by COVID, they are still getting sick, unfortunately, and going into the hospital and getting very sick from COVID. And we look at the information and data about children with COVID, we see that those who go into the intensive care unit, the ICU, half of those kids don't have any underlying medical conditions that would make us think we understood why they got so sick. So we are still seeing COVID make kids very sick, and no kids should be in the hospital and dying from a preventable disease. And this is why I got my daughters vaccinated, and that's why I would recommend to any family member of mine to get vaccinated. I wouldn't recommend something for the American people I wouldn't do for my own family. And that's why my parents who are over 65 are vaccinated. I got vaccinated. My daughters are vaccinated. My husband, right? So it's really important to make sure we're taking advantage of these tools. And I'd encourage folks to talk to their pediatrician about all this information.
Okay, here's one last one. How should we understand the risk of the COVID illness versus the risk of the COVID vaccine?
That is a good question about balancing risk and benefit. And I can say unequivocally, the benefits of the vaccine far, far outweighs the risks when it comes to COVID specifically. It's not close. And in fact, our independent reviewers of the vaccines that make the recommendations to the CDC before we make our final decision, they look at exactly this question. They look at what are the risks if you get COVID and what are the risks if you get vaccine. And across every age group, vaccine continues to be safer and protect folks from infection, whereas getting COVID itself still, again, could make you very sick and have you go into the hospital and potentially even die. So we continue to evaluate this, but from the risk and benefit, it is exactly why I recommended this to my own family, because I think the benefits of vaccine far, far outweigh the risk.
Okay. Very good. Thank you, Dr. Cohen. Now it's time to address more of your questions with CDC Director Dr. Mandy Cohen. As a reminder, press *3 at any time on your telephone keypad to be connected with an AARP staff member and ask your question live. Kevin, who do we have up next?
Bill, our next call comes from Jerry in Alaska.
Hey, Jerry. Welcome to the program. What is your question for Dr. Cohen?
Hello? Am I on?
You are. Go ahead, Jerry.
That was Arkansas, not Alaska.
Okay. Sorry about that. It's a lot warmer than Alaska, that's for sure.
Yes, sir. Okay, my question was, I was wondering on a flu shot, how long does that usually last, and how long on these vaccinations do they last?
Yes, Jerry, wonderful question. So we encourage every season ahead of when we see the highest amount of flu activity for folks to get vaccinated. So that's why September, October, November is really the time where we say to get vaccinated. We are just starting to see flu start to circulate. We'll probably see the most flu now that we can sort of see into the season, we'll probably see most of the flu circulate in the month of January. And so this allows your body time to build up the antibodies. Probably it provides protection for 6 to 8 months, which gets you through the flu season. And then in the summertime, in the northern hemisphere, we don't see very much flu, and then it's time to get your flu shot again. So getting your flu shot in the fall protects you through the flu season, which is generally the winter and just into the beginning of spring. Then we have the summer where we don't see a lot of flu, and even though your protection may be going down, it's okay because we don't see a lot of flu, and then it's time to get another flu shot. On the COVID side, this is where we're still learning about how long these vaccines are lasting and protect us, and what is that cycle? Is it similar to flu? Is it always going to be higher in the winter? It looks like from the last number of years we will continue to have higher amount of virus in the winter, but we're still looking at the science for that. We are seeing that the protection from our COVID vaccines generally, again, for a healthy adult, lasts around 6 to 8 months. But for people with immune systems that aren't as strong, sometimes they need additional doses sooner than that to make sure they're the most protected. So it's a good question about the flu shot. Again, we get it once a year, protects you all the way through flu season. The COVID shot, we're recommending it now ahead of the winter surge that we are expecting from COVID. And then we will have to learn, and this is where the science will continue to help inform us here about when we might need another COVID shot. Will it be like the flu shot and every year? I don't know for sure, but it is likely that it will become just like the flu shot once a year.
Okay. All right. Thank you, Dr. Cohen. Kevin, who is next?
Our next caller, Bill, is Lori from Florida.
Hey, Lori. Welcome to our program. Go ahead with your question.
I recently had a mastectomy, and I'm very vulnerable to disease because I have lost over 20 pounds. I'd like to know how long I have to wait after my mastectomy to get all the shots. The only one I don't need the second shot of shingles, because I had shingles when I was in my 30s. I'm in my 70s now, and it was the most painful thing I ever went through. It was worse than a toothache. Worse than a mastectomy.
Yeah.
Go ahead, Dr. Cohen. Yep.
I was going to say, well, Lori, first, sorry to hear about some of your health issues. And what I would say is you want to get vaccinated to protect yourself. Obviously, talk to your doctors. I don't know all of the medicines and your medical history, but generally we do not, there is no reason to wait to get your vaccines to protect yourself, and in fact want to make sure you get them as soon as possible, because you, as you were saying, you are in a bit of a more weakened state as you are fighting off cancer and recovering from a surgery. We want you to be the most protected. So I'd encourage you to talk to your doctor, because again, I don't know every detail of from that one question of your medical history, but I don't see any reason to wait. So I'd encourage you to talk to your doctor and get all of the vaccines to protect yourself ahead of this winter season.
Okay, very good. Thank you. And we've been asked to restate the information about how to get those 4 free COVID tests. You can go online to covidtests.gov, or you can call a toll-free number, 1-800-232-0233. Kevin, who do we have up next?
Our next caller, Bill, is Ola from Washington.
Hey, Ola, how are you? Welcome to our program. Go ahead with your question.
My main question is, I'm hoping that we can get some information on how to make sure that we have our immune system built up, and it will help keep us safe.
Dr. Cohen?
Yeah, great question. Ola, right? Our immune system is what helps protect us against all of these viruses, bacteria, what have you, protects us from getting very sick. And there are a few ways in which you can continue to keep your immune system boosted up. We've been talking a lot about vaccines, and vaccines is obviously the best way you can train your body, build new antibodies to build up your immunity and protect yourself. So vaccines really are the training way in which we teach our body and strengthen our immune system. But there are other ways you want to continue to keep yourself healthy: getting enough sleep, eating a healthy diet, getting exercise, going to your doctor and making sure you're keeping your chronic diseases, whether that's diabetes or hypertension, making sure they are as well controlled as possible. Those all fit together. All of those things matter to having a strong immune system as well. So vaccines train your body and train your immune system, but all the things we've known since we were in school about good sleep, healthy diet, exercise, and managing your chronic medical conditions all matter to help keep us healthy.
Okay, very good. Thank you for all those questions. We're going to take more questions shortly. Remember, if you'd like to ask a question, please press *3 on your telephone. Doctor, recent analysis of 2023 CDC data is clear. COVID hospitalizations and deaths overwhelmingly are among adults 65 and older. Could you briefly review the vaccines and treatments that are available for COVID today, how they differ, and why they matter?
Sure. You are absolutely right that the folks who are still at the highest risk are those who are over 65. It's why I have been visiting senior centers and nursing homes and senior living all around the country to make sure we're getting this word out. The updated COVID vaccines are recommended for everyone 6 months and older. Remember, the two reasons you want to get the updated COVID vaccine: the virus has changed, so you want to have the updated vaccine to protect you, and your protection from before has decreased over time. So you want to get that updated COVID vaccine. If you are sick, what I want to remind you, it's important to test yourself. So if you get a fever or chills or body aches or you're not feeling well, it's important to get a test to know what virus you may have. And again, we've been mentioning you can get 4 free COVID tests at covidtest.gov. And you want to test because treatment can also save your life. So you want to know what you have because there is treatment both for flu and for COVID. And there are different kinds of treatments. So you need to talk with your doctor about those. But it could both save your life, save you a trip to the hospital, and prevent you from getting long COVID as well.
Okay, very good. Dr. Cohen, one more question for you before we go back to our phone lines. A lot of early vaccine dissenters said they wouldn't get a COVID vaccine because it was untested. After hundreds of millions of mRNA vaccines administered over the past 3 years, what do we know today about the safety and efficacy of COVID vaccines?
Yeah, Bill, great question. I want to remind folks now, after the last 3 years, hundreds of millions of doses of the COVID-19 vaccine have been administered to Americans under some of the most intense safety monitoring efforts that we've done in U.S. history. So these COVID vaccines do meet the FDA rigorous scientific standards for safety. They go through a CDC review process before we recommend them and after we recommend them. And, again, I would not recommend something for Americans I would not recommend for my own family, including my own parents. My parents are here today with me, and they've both been vaccinated. It's because I want to have a happy Thanksgiving, and I want that for you as well.
Okay, very good. Let's go back to our phone lines. It's time to address your questions with CDC Director Dr. Mandy Cohen. If you've got a question, press *3 anytime on your telephone keypad. Kevin, who's up next?
Bill, our next caller is Dawn from Pennsylvania.
Hey, Don. Welcome to the program. Go ahead with your question.
I am 86 years old, and I want to know how often do I need a colonoscope? I had one 4 years ago, upper, lower, and the middle one. And I didn't have a very good I had good results from it, but I didn't feel so good, and I had an accident when I fainted. But how often should I get it again now that I'm 86 years old? How many times should I get this? Okay?
Yes. Well, great question. We've always been talking about vaccines, but there are a lot of ways in which we can protect our health and do these screening opportunities. I think we were talking about colonoscopy there. And for people 45 to 75, generally the recommendation on average is to get a colonoscopy once every 10 years. But then once you're over 75, there's a conversation you want to have with your doctor about how often that might be a result of what did they find on your last colonoscopy, what's going on with your other medical conditions. So I would encourage, Dawn, for you to talk with your doctor about what's right for you. Like I said, generally it was once every 10 years for folks, but as we get up in age, there are other factors we want to think about that you want to talk about with your doctor in terms of how often. Sometimes it's more often, sometimes it's less often once you get into older ages.
Okay.
But thanks for protecting yourself.
All right. Thank you. Kevin, who do we have up next?
Our next caller, Bill, is Christine from New Jersey.
Hey, Christine. Welcome to our program. Go ahead with your question.
Hello, good afternoon. I'd like to actually first thank all three women for their advocacy work, especially in affordable care for our most challenged populations and access for necessary medications for our seniors. So, well done, ladies. My question for Dr. Cohen is, in hindsight, the coronavirus kind of crept up on us quickly. It had been considered a common household virus. Mm-hmm. And looking back at how it made the leap from that to being a potentially lethal condition, what is the CDC doing to ensure that our other common household viruses, we are better prepared early on with vaccines in case they also make that leap? Because as we know, viruses will try to survive, or, there's also a fear of things getting genetically modified. How can the CDC be better prepared? Because COVID really shut us down in a very harsh way.
Christine, great question about how do we stay prepared and identify health threats and respond to them quickly. That could be a virus or it could be a different kind of threat. And I think we have learned a lot through COVID about how to make sure we have systems in place that are identifying changes to viruses. Now, I want to assure folks that we have an extensive network that is supported by CDC and many others that we are constantly testing and what's called genomic sequencing. So we're looking at the genes of all of these viruses to try to understand how they change, if they are causing more illness. So we do have an extensive network, but because you mentioned how important it is for these systems to exist. It does take money and resources. It's why it's important to make sure that we have a well-funded and well-resourced public health infrastructure, because we need to keep identifying whether it's viruses or others and understanding how they're changing and making sure we're staying on top of it. And that takes work and investment, just in the same way we would invest in our military to protect us against military threats. We need to invest in the CDC and public health to protect us against health threats, because we know viruses change. As you said, Christine, exactly right. They want to change. The viruses want to change. They want to potentially move around more, right? That's what they do. And we have to stay ahead of that. But it takes the investment, just like we invest in the military, we need to invest to protect ourselves from those threats. And that's exactly what the CDC is doing for you every single day. But we need to make sure that you can also help us stay strong and do everything you can on your part. Getting vaccinated certainly helps us all, right? Make sure that we are all protected and healthy and cuts down the amount of virus that circulates. And that means less virus to change or see if it would get worse. So all of this does help protect each other.
Okay, very good. Let's take one more question. Kevin?
Absolutely. Our last question comes from Nancy from New Jersey, and she writes that she recently recovered from COVID and wonders how long immunity will cover her and how long she should wait to get the vaccine.
Great question. Dr. Cohen?
Yep. Nancy, great question. So we say if you've just had COVID, about 2 months until getting your vaccine. So I'd set yourself a reminder, 2 months from the time after you were better from COVID, and that's when to get your updated COVID vaccine, 2 months.
Okay, very good. This has been such an informative discussion. I want to thank you, Dr. Cohen, for answering all of the questions here today. And thank you, our AARP members, volunteers, and listeners for participating in this discussion. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. All of the resources referenced today, including a recording of the Q&A event, can be found online at aarp.org/health discussion, starting tomorrow, November 10th. Thank you and have a good day. This concludes our call.